Hello everyone, I am Dr. Abhijith. I am a gastroenterologist by profession. I work in Department of Medical Gastroenterology, Aster Whitefield Hospitals. Today we will be talking about non-alcoholic fatty liver disease, or recently known as metabolic disease associated fatty liver disease. India has a lot of burden of cirrhosis or scarring of liver. Nearly 2.1% or 2 to 3% of deaths occurring in India is due to liver disease or cirrhosis. What are the most common cause of cirrhosis? We all know alcohol and hepatitis B. But there is a silent killer among this which causes cirrhosis, that is non-alcoholic fatty liver disease. With hepatitis B vaccination coming into forefront, the causes of cirrhosis, hepatitis B causing cirrhosis will gradually come down, and as we know, obesity has become a pandemic with most people being obese. Non-alcoholic fatty liver disease is going to become a most leading cause of cirrhosis in India. So what is non-alcoholic fatty liver disease? It is a medical condition in which there is lot of infiltration or deposition of fat in the liver. Some people among them have a condition called NASH, that is non-alcoholic steatohepatitis, where along with the deposition there is inflammation in the liver. This causes gradual scarring of the liver, ultimately leading to liver failure. This fatty deposition can occur in other conditions also, where people have excessive alcohol intake or some hepatitis like hepatitis C and few drugs. But to be labeled as non-alcoholic fatty liver disease, patient should not have any history of significant alcohol intake, and we have to rule out viral infections and other drugs causing fatty liver. So let's see what this fatty liver can cause and how to manage it. Discussing about the causes of fatty liver, 70% of patients with fatty liver, that is non-alcoholic fatty liver disease, have diabetes. 75% of them are obese, that is their weight is above the normal expected range. Most of them have, that is 20 to 80% have dyslipidemia, that is bad cholesterol. And insulin resistance, that is body produces insulin but the cells are not sensitive to the insulin that is produced. That is also commonly found with non-alcoholic fatty liver disease. All these together are called as metabolic diseases, metabolic syndrome. This also increases the risk for blood pressure, heart disease, and mortality will be more. Along with this metabolic syndrome, there are few drugs that can cause fatty liver whose details is beyond the scope of this video. So with these causes, what are the symptoms? How will we know that we have fatty liver? Unfortunately, fatty liver, as I called it, is a silent killer. Symptoms are very rare. If symptoms are present, there will be mild fatigue and mild upper abdominal pain. Most cases of fatty liver are detected incidentally, like when you undergo a health checkup, ultrasound is done for some other reason, we see fat deposition in the liver. Sometimes people undergo a liver function test where the liver enzymes are elevated. Then retrospectively we assess and we find that there is fatty liver. Coming to the diagnosis of fatty liver, this is diagnosed by few tests. Most common is, as I told, ultrasound. Ultrasound can show whether there is fat deposition in the liver. Sometimes if fat quantification is required, we can ask for a MRI of the liver. And earlier, liver biopsy used to be done in few selected patients to see whether there is any scarring of the liver or to assess how much fat has been deposited. Recently, we have a non-invasive test called FibroScan, which is just like an ultrasound. A probe is used to determine the amount of fat deposited in the liver, and it also gives us an assessment of how much scarring or fibrosis has happened in the liver. So what is the course of disease in NASH or non-alcoholic steatohepatitis? Most patients with fatty liver, non-alcoholic fatty liver, remain stable throughout their life with the fat deposition not causing much trouble. But in some percentage, the disease can progress to cirrhosis, that is scarring of the liver. Unfortunately, we don't have any tests which predict in which patients it will progress, in which it may not. So we have to be cautious. Coming to the treatment part, once you have diagnosed with NASH, what are the treatment options available? So basically there is no medical cure for NASH as such. Most therapies are aimed at treating the underlying conditions which led to NASH, like diabetes, obesity, or hyperlipidemia or dyslipidemia, that is cholesterol. The best and most proven way is weight loss. Obesity is the major risk factor for metabolic syndrome and NASH. So we have to lose our weight. Even losing 10% of our weight has shown that there is a significant improvement in the fat deposition and fibrosis score. But we should not hurry with the weight loss. Ideal target would be to lose around 0.5 to 1 kg per week. Excessive or more aggressive weight loss is known to increase the fat problems with the liver. So ideally we have to lose 0.5 to 1, but the most difficult part is maintaining the weight after reducing it. If we regain the weight, NASH may reappear, so lose weight and maintain it in that steady state. Other medications have also been studied. One is vitamin E. Vitamin E supplementation has known to alleviate or decrease enzymes in patients with fatty liver, but this is not advised in patients with diabetes or heart disease. Those who do not have diabetes or cardiac risk factors can be given vitamin E, but there are a few studies which tell it can cause other problems like prostate issues, or it can increase mortality. So I suggest you, if you have fatty liver, please take vitamin E in consultation with a doctor, and please do not self-medicate. Many other newer drugs which target insulin resistance are available, but evidence is still forming. There is still some time before we recommend all of this for regular treatment of fatty liver. Another main option is lifestyle changes. That is, patients with fatty liver should stop alcohol consumption completely and maintain a healthy lifestyle. And coming to this, like all diseases, prevention is always better than treating it after developing. So from the initial years, if we maintain a good lifestyle, avoiding alcohol or moderating alcohol use, and maintaining our body weight with the accepted range with exercise and diet, fatty liver may not develop. So my suggestion is, instead of treating fatty liver after being diagnosed, it is better to develop a healthy lifestyle, adopt a healthy lifestyle, and prevent fatty liver from developing. Thank you everyone.